difference, which is quite difficult. Um, After leaving Park Center, I began working for a provider where I was an area coordinator. Um, we had things kind of split up at that time between wellness, um, medical, and then behavioral. I was the area coordinator for the behavioral part, so I worked with all of the high behaviors, and just anybody with obesity or who showed signs of behavior issues, they were on my caseload. Um, Worked there for a few years, left there, and became a case manager. And now that our population that we're working with, I've seen in the last 13 years, of course, that we've seen a lot of aging. Um, and because of that, we really need to be aware of dementia. Is it dementia or is it a mental illness? How do we tell? So I want to go ahead and start the slideshow. Like I said, when it comes to the aging population, which we are now seeing more of, it really is difficult to tell between the two, but there are signs. Most commonly, dementia presents itself in the elderly population through memory loss, impaired reasoning, and personality changes. On the other hand, a mental illness refers to a wider variety of mental health conditions that impact mood, thinking, and behavior. While dementia does affect overall mental health, it is not a mental illness. I'm in researching this. I have seen where some websites have said yes, it is a mental illness, but when you're looking at the diagnosis as far as the Alzheimer's Association and all the bigger ones are saying no, it's not a mental illness. This is the scary part and really opened my eyes where that with 1 in every 3 seniors developing Alzheimer's or other forms of dementia annually, it is vital to receive a proper diagnosis to ensure the appropriate treatment is provided. 1 in every 3. That's pretty scary. It is common to see misdiagnosis because they have very similar signs and symptoms, um, such as confusion and mood swings, also depression, and so it's pretty hard to tell the two, and you're going to have to rely on a doctor. Um, but hopefully through here, I can give you some things to look for. And we'll begin by just talking about what is dementia. Dementia is the loss of cognitive functioning, the ability to think, to remember, to reason, to an extent that it interferes with a person's daily life and activities. I know we all have those moments where I forgot where I put my keys. I didn't remember this appointment, my doctor's appointment, or whatever. But the difference with dementia is that it interferes with a person's daily life and activities. These functions include memory, language skills, visual perceptions, problem solving, self-management, and the ability to focus and pay attention. Some people with dementia cannot control their emotions, and their personalities may change. Dementia ranges in severity from the mildest stage, when it's just beginning, and a person may forget a word or two or have a little bit memory loss, to the most severe stage, when the person is completely dependent on others for their basic activities of daily living. By the time dementia gets to the end stages, a person cannot care for themselves. Excuse me. Some of the symptoms of dementia. I'm sure most people, I know in myself, the first thing I think of with dementia is memory loss. That is the most common. But in addition to memory loss, other impairments may be problems with communication and language, cognitive ability, reasoning and judgment, and visual perception. These are the most common that you'll hear about or see, but there's a wide range of other symptoms. Some might be difficult with balance. A person, may not be able to walk as good as they used to, or you might begin to see tremors, which makes the diagnosis kind of difficult if you ever hear that it's hard to to diagnose Parkinson's from dementia, they do present some of those same symptoms. Trouble eating or swallowing, memory distortion, and by that I mean a person may believe that a memory has happened when in actuality it never did happen, or a memory that happened from an event that happened, say, 30 years ago, they may insist happened last week. Um, so they're also, I'm sorry, I have to take a sip of something, but they're also may have problems with combining two memories. And it could be a memory from 10 years ago versus with a memory that happened yesterday, and they'll combine the two and get very confused. So those are just a few others of the symptoms. But for the main symptoms that we usually see, I'd like to go into those a little bit more, such as memory. Um, Dementia affects the region of the brain called the hippocampus. And the hippocampus is where the brain cells are that for memory. So that's why memory loss is often one of the earliest symptoms. Often, but not always. Um, Quite interesting, I find that in studies for dementia with individuals who have intellectual disabilities, in studies I've read more specifically with Down syndrome, they often do not even see memory loss as one of the signs for dementia. So that's very interesting, but usually the memory loss is one of the earliest symptoms of dementia. Like I said earlier, although forgetfulness can be mistaken for a senior moment, or if we forget where you put your keys or you forgot to do something, I experience that a lot. Brain fog, we call it, and it is a normal part of aging. Memory loss is an early sign of dementia because as the disease progresses, where I might once once in a blue moon forget where I laid my keys, this symptom of the forgetfulness with dementia will progress. It will get worse. It will get to a point where it disrupts their daily lives and activities. Um, so I know someone who, because they forgot something, they swore they were getting dementia. That while that is the most common, it does get to a point where they really can't remember anything. With communication and language, it's not usually something that one thinks about with dementia, or I know I didn't. But it's definitely a symptom. They have difficulties with speech. In some people, that's the first noticeable symptom. At first, they may carry on a normal conversation, but forget a word. Or if the person with the beginning stages of dementia may have difficulty resuming a conversation after an interruption. As the dementia progresses, what you'll see in all the symptoms, as it progresses, things get worse. But as the dementia progresses, it becomes harder for the individual to remember or to learn new phrases. The short-term memory in dementia is much more difficult for a person to grab and get a hold of and remember things they just learned than long-term memory. And a person may begin confusing the meaning of words, or they cannot. I think it's known as word salad. You can't think of the word that they want to say, and they'll just stick in another word that comes to their mind, and it may not make any sense at all. It's also more difficult for people with dementia to hold several ideas in their head at once. If you're working with somebody with dementia, you want to keep things simple. Or if they're talking to you, this is why if they're talking about one thing 1 minute and then in the middle of the conversation may jump to another topic, it's very difficult for them to keep things sorted and to hold several ideas in their head at one time. Cognitive ability. We all know that the way we think, the way we learn, our cognition is definitely, people with dementia are going to have a decline in that. They have difficulty with time and place. Getting up in the middle of the night to go to work when they've been retired for years. Um, Concentration is also affected. They have difficulty with shopping and choosing items and with paying for them. For some people with dementia, the ability to reason and make decisions may be also affected. Some people with dementia get a sense of restlessness and prefer to keep moving, while others just kind of isolate themselves. And then the last of the four that I put up, reasoning and judgment. Poor judgment refers to the inability to make appropriate decisions. I'm not talking about, we all make bad decisions. Or I know I certainly have. Um, that's life. But in dementia, it gets to a point where it can be daily and it can also be dangerous. This symptom does sometimes precede the symptom of memory loss. Um, with poor judgment, it will affect safety and danger. Put a person in danger. They may wander away from home and walk into the middle of a busy intersection with complete disregard to traffic coming. Absolutely no personal safety. I had an aunt who had Alzheimer's, and we found her cleaning her oven with the oven on. It was a gas oven. The fire wasn't on, but the gas was on. And she was cleaning the oven. She knew it was on. It wasn't a mistake. She put it on to clean. So complete disregard for safety. Problems with finances. Because of forgetfulness, they're very vulnerable, which they may put them in a position of giving away money and not, they may give away their money now with absolutely no regard for needing it in the future for their medical needs. They also sadly fall prey to scammers or con artists. So if you start noticing money missing, they may hide their money and forget where they put it. Is also poor judgment. Under poor judgment is the inability to do their normal routine grooming, hygiene, and dressing, where a loved one, or one of the individuals you work with, you may notice they take great pride in how they look, and they suddenly start to not care, no longer put on the makeup, no longer fix their hair, they just don't care. It could be the middle of winter, and they have on shorts. And then when you try to address that with them, they become very agitated or angry. Um, and also, person with dementia, under the poor judgment, comes driving. They may think that they still can drive. They don't realize the extent that the dementia is progressing and the damage that it has done, and they may still insist on driving. If you think about it, driving is, you're very independent when you become, I don't know how old if they are now, 16, 17, I don't know, to get a driver's license. I don't know what the age is now, but that's a great freedom. Oh, all right, I can go. And it's the same thing when you become older. You don't want to give up that independence, that sense of freedom. You don't want to argue with the person either. But if you find yourself getting in a car with somebody and they disregard signs, stop signs, or traffic lights, or they just pay no attention to the dangers around them, they need their driver's license taken away. This could be a sign of early dementia, and they can't drive. Instead of arguing with the person, simply a great source to go to would be their physician. There are tests that can be given where specialists can determine a person's ability to drive. Here locally in Fort Wayne, I know Parkview offers the test, but I'm sure any hospital you go to, any community center, or different associations like AARP, AAA Insurance, Alzheimer's Association, they're all great resources for finding out and giving this test. to see if a person has reached the point where they no longer can drive. And then visual perception. The person, oh my gosh, I'm sorry. Oh goodness, where'd I go? I am so sorry. One of my cats just hit my mouse and it took off. Okay, visual perception. A person with dementia may experience hallucinations. I'm sure we're all familiar with the misidentification. They may think that their grandson is their husband. Um, Difficulty with depth perception. This causes a great risk for falling, and with misinterpretation. So these are some symptoms of dementia. Now I'd like to go on. Well, before I even go on into mental illness, I would like to say that there are also symptoms that mimic dementia, but they are treatable and they're not dementia. I certainly found this out when I started working at Byron. I did not realize that there were so many symptoms from other things that can mimic dementia. The most common may be, so, if you're seeing an individual who is starting to show signs of dementia, before just writing them off saying, it's dementia, make sure, always make sure you're checking for medical reasons first. You may be looking at a vitamin B12 deficiency, which does cause confusion, or it can cause confusion, irritability, and slowness. Any other type of vitamin deficiency may mimic the symptoms of dementia. Depression, it certainly can mimic. If you're really severely depressed, you may have forgetfulness, a lack of focus, and it makes sense that as a person ages, they may become depressed. They're losing friends that they've known all their lives. They see the end of their lives coming. They know they don't have that many years left, so it may be depression, maybe thyroid problems, could be side effects to medications. Um, if the person was diagnosed, say, with a mental illness and was on an antipsychotic drug, some kind of drug, anti-anxiety drug, withdrawal from that can also mimic very closely the signs of dementia. And one thing that I always bring up to my teams when we're seeing behaviors, does the person have a urinary tract infection? The UTI in some people, especially older adults, can cause a sudden onset of symptoms that look like Alzheimer's disease. They can become confused or upset, sleepy, inability to focus. UTIs are. It amazed me when I learned that at Byron how closely the symptoms can be with the UTI. So you wanna get medical things ruled out first. Okay, mental illness. I'm sure we all work with at least a couple of consumers on our caseload who have a dual diagnosis with the mental illness. As many as 1 in 5 older adults experience a mental illness that is not associated with the normal process of aging. Unlike dementia, mental health disorders can be treated and managed, whereas dementia, as I said a few times, will progress and get worse. Mental health can be treated, it can be managed. If you believe that your person that you're caring for, that you have on your caseload, that the person that you love is experiencing a sign of mental illness, it's important to seek out professional treatment as soon as possible. Some of the most common signs of mental illness in older adults includes anxiety, depression, bipolar disorder, and schizophrenia. Anxiety. Many older adults suffering from anxiety were likely to have experienced it as at a younger age, but that doesn't mean they had to. For seniors, signs of anxiety can include constant worrying about family, worrying about friends and money, trouble sleeping or irritability, and racing or unwanted thoughts. As I said earlier, depression is one of the most common mental illnesses among older adults and seniors. Um, it's commonly overlooked. I'm sorry, it's also a symptom of dementia and is commonly overlooked. Depression is commonly overlooked as a mental health disorder. For the senior, it could be they just automatically think dementia. But as adults age, they may suffer from a lack of mobility, can become socially isolated and depressed. So giving up that freedom of being able to drive, not just because of dementia, just because they're getting older. Um, like I said earlier, seeing their loved ones pass, their children growing up, getting married, moving on to other states, they can become depressed. So it's pretty common. If their sadness, however, persists for longer than 2 weeks, it is important to seek out medical attention. And I'd say that with anyone, but with older adults, you want to keep an eye on them. Bipolar disorder. There is such thing as late onset bipolar disorder, and it is difficult to diagnose again because of the similarity to dementia. Some of the symptoms include irritability, manic behaviors, and delusions. Recognizing these symptoms accompanied by other signs of bipolar disorder include fatigue, weight gain or loss, paranoia, impulsivity, crying, and aggression can help differentiate between dementia and mental illness. So dementia, you won't necessarily see the the weight gain or loss, the paranoia, the aggression. So that's one of the many. But again, please don't try to diagnose anyone. You want to take them to a professional. And then there's schizophrenia. I know most people are aware that schizophrenia, the usual onset for schizophrenia would be late teenage, early 20s. But there is a late onset for schizophrenia, and it is difficult to diagnose. It will develop after the age of 45 and can present itself as you get older, not just at 45. But I was always very used to schizophrenia. I look out for the signs in early adulthood, but also late adulthood. The most common signs of this mental illness include hallucinations, paranoia, disorganized behavior, and lack of restraint. As I've said a few times, unlike dementia, mental illness and mental health symptoms can be treated. But the real kicker here is the treatment for and approaches that work for people don't necessarily work for people with dementia. Older adults react to medications differently. Medications commonly used to treat psychological symptoms can make symptoms of dementia worse. They can also cause other adverse effects like increasing the risk of falls. Antipsychotics should only be used in people with dementia as a last resort. Yet they are often overprescribed to treat psychological and behavioral symptoms, despite guidelines. Yeah, it has been shown antipsychotics, and as I said earlier, coming off of them will definitely mimic signs of dementia. And because of that, and dementia will also mimic signs, of mental illness. So a lot of doctors, sadly, frequently just go to, okay, here's a Prozac, here's this, and that'll make you feel better, when really for dementia, it only makes things worse. The main difference between dementia and mental illness is that mental illness can be managed. Like I said earlier, it can be, I don't want to say cured, but there are treatments for mental illness. Where dementia, you're just going to see things progressively getting worse. Most dementias are progressive. There will be, over time, much more brain tissue lost. Sometimes it comes in big waves, like all at once. The person will get worse and worse. Dementia will end with a person losing the ability to breathe, swallow, and perform the most basic functions. Mental illness in general is not progressive. Some people may not like to take their medicine, but it does help. Where there, as of right now, there is no medication that will help dementia. Um, Another sign that you may also be able to tell whether it's a mental illness or dementia. One symptom is called sundowning. That refers to the changes that a person is acting, and you'll notice these changes in late afternoon, early evening. No one seems to know why this occurs, but it has been found that sundowning, the fading of light does seem to trigger behaviors. So if you have an individual on your caseload and they're starting to show signs or more behaviors, it's important to take a look at what time these behaviors occur. Are they starting to show this right as the sun's starting to set, um, um, or as it gets darker? Then it may be sundowning. And the last thing you want to do if it's sundowning is increase that psychotropic medication, because it won't help. And not only will it not help, it will make things worse. Um, when we think of dementia, we almost always think of it in relation to age, but there are exceptions. Like everything else, there are exceptions. We're starting to see more of the chronic traumatic enceph. I had it right before this call, and I knew I was going to mess it up in the call. Chronic traumatic encephalopathy. I'm not even going to pretend because I'm on the call and I'm kind of nervous and I'm just going to screw it up. I can tell you what it is though. CTE. I'm sure you've seen stories where football players, the NFL, got this big thing going on, checking to see the football players who have constantly over the years in their careers had blows to the head. Boxers are also very prone to this. That causes CTE, and that's a form of dementia. So they'll see also somebody who gets a lot of concussions. If they play a sport and get a lot of concussions, leads to dementia at a younger age. So anyone who's had a history of this needs to be really careful. The dementia may not wait until they're elderly. It can show up earlier. The causation criteria for dementia starts to vary a little bit when talking about dementias or different types. With this being the most important point, dementia, you will have a loss of nerve cells and brain atrophy. One thing to remember when talking about mental illness and dementia is there can frequently be a lot of overlap between the two. The chemical imbalances responsible for schizophrenia can easily trigger dementia. So a person can have both. One thing that I found, unfortunately not a lot of, but I did find some studies with dementia slash mental illness slash individuals with a developmental disability or an intellectual disability. I couldn't find many studies, but there were a few. And I found some interesting, I mentioned earlier, is the symptoms of Alzheimer's may differ completely with somebody with Down syndrome. In the early stages of dementia in a person with Down syndrome, it's been found that memory losses, they don't always see memory loss. And a lot of the other symptoms are not there, of your typical symptoms with Alzheimer's are not there for a person with an intellectual disability or Down syndrome. What they recommend you really keep an eye out for is changes in activities of daily living and work habits. That's the things that usually they first will notice. If a person's very active, they go into work, they like going to their workshop, they enjoy doing things. But then as they age, not only do they say, hey, I want to retire, They just they no longer care for themselves. They no longer do the things in their homes that they were able to do, and become much more dependent on staff. And so that's also can be, it's tricky because looking for that in the population most of us work with is a little bit more difficult than in the general population because they don't show the same signs, or they may not. Um, Also, many of the standard tests do not work on somebody with an intellectual disability. So usually diagnosis in an individual with an intellectual disability is just exclusion of everything else. So I know everything I just told you, and now I'm telling you, well, it may not, but these signs may come up, and it is important to know. But with the population we work with, we just need to keep our eyes a little more open, um, be aware of changes and different things that's happening as our population ages. Um, if you have a concern as the population ages, I don't want to say treat the person like a child, because I don't ever say that, but treat the symptoms as if you have your aging population, you work with a large amount of aging population, you want to treat their symptoms. I usually ask myself, if my small child, or in my case, my grandchild, showed these symptoms, would I ignore it, or would I take them to the doctor? Same thing with as they're aging, because they're not, especially if dementia is coming on, may not be able to tell us. If you have an individual who's always, not always, but since you began working with them and for many years have had behavioral issues, needed the help of a behavior consultant, maybe needed to be hospitalized a few times, then you may not recognize, you may think, okay, but somebody who has not had this, and you're suddenly seeing this as they're aging, it may be, and probably as dementia or some form of dementia. So that is all that I have. Carrie, did you have any questions that came up?
One person just mentioned that they've experienced some of their consumers that display many behaviors with UTIs, but there aren't any
Right.
other questions. So if anyone has any, go ahead and type them in and we can get them answered.
Yes, please use the chat box. I'm certainly not, a professional in this area, but I have worked with it. I am fascinated with it, and if I don't know the answer, I will absolutely get back with you and give it to you.
None are showing up, so I don't know if anyone's
Okay.
typing. You can give them a couple minutes.
Yeah, I was going to give a few minutes to see if anybody's typing. I do want to thank everybody for joining. Sorry if I was a little nervous, but this was the first one I've ever done. So I thank you so much for your patience.
You did a great job.
Oh, thank you.
Well,
Okay, I don't see where any questions are being typed up. So again, thank you
here's
very much for. Go ahead.
here's one question. If
Okay.
you know a physician who is prescribing psychotropics, what is the best way to advocate that these be stopped if they do not have a mental health diagnosis?
Why are they on psychotropics without a mental health? Are you always, again, like I said, I'm not. If that were in the case of somebody I worked with, I would probably ask for a second opinion, or are they on it for seizures?
And someone else asked if we'll get a copy of the PowerPoint. And yes, I believe that the PowerPoint and the questions will be available. And then there's also a recording if anyone wants it of the training. And I know you'll get an email of your attendance of this webinar also for proof of your attendance. And no one elaborated on the question.
Okay. Yeah, I guess I would just, working with the individuals I work with, I would certainly ask for a second opinion, even ask the primary care physician what their opinions are in that matter and why is that person taking a psychotropic med.
Those are all the questions.
Okay. Well, thank you all so much. I really, really appreciate you attending. And as Carrie said, this will be available. The slides will be available. And there's also a recording. You also will get that email that you can turn in order to get credit for attending. Thank you all, and I hope you have a pleasant rest of the Monday and a great week.
Thanks, Renee.
Thank you.
Bye, everyone.